Doing my 7 steps of hand hygiene. 1, 2, 4, 5, 6. That has been my very objective. I know that, like in my case as a nurse, I've always wanted to help, but in some other ways, being a teacher and doing this, informing you.
Start.
I am tasked to do a catheter removal of patient Andrew patient. So first things first, I will do my 7 steps of hand hygiene. 1, 2, 3, 4, 5, 6, 7. I let my hands dry. Assuming that safety and privacy have been ensured, identity and allergy have been checked, pain and comfort have been addressed, procedure explained, and consent taken, I'm now happy to prepare my materials. First, I will get a visibly clean apron. And I will get a pair of gloves from a box that's dry, intact, and in date 2022. I will prepare my tray first. I will clean my tray. This tray has already been cleaned with soap and water for the past 24 hours, but I'm still happy to clean it with the clinical wipes coming from a box that's dry, intact, and in date 2025. I will clean the tray from farthest to nearest using an S motion, including the sides, as well as the bottom. And then I will throw this in the clinical waste bin, including my gloves. I will, Assessor, is it alright if I keep this apron on? Yes, alright. So I will now be preparing my materials. I will get a pair of gloves from a box that I've already checked a while ago. My Dolly pot, that's dry, intact, and in date. My 10 ml syringe, which is the same as the documentation, 10 ml syringe. That's dry, intact, and in date. My gauze, that's dry, intact, and in date. My cleaning solution, sodium chloride, 0.9%, that's dry, intact, and in date. My alcohol swab, that's dry, intact, and in date. Alright, I think I already have the necessary materials. I'm now ready to go back to my patient. So, hi Andrew, I'm back. I already have the materials that I need in order for me to take out your catheter. Are you still happy for me to proceed?
Yes, I am.
Alright, now let me just expose the catheter a little bit. Is it alright?
Yes.
Okay, let me check. So I can see that the catheter is still patent. There is a free flow of urine. However, the bag has already been emptied to prepare for the removal, and the fluid in the bag, or the urine in the bag, is already well documented in the fluid balance chart. Alright, so Andrew, I'll just explain to you that I will be removing your catheter as ordered by your doctor, and in the removal of your catheter, you may experience frequency, urgency, and discomfort as the catheter will go through your urethra. And then in this procedure, I also would just like for you to take a deep breath and before I take out the catheter. Anyway, I'll explain that further later. All right. Now, in this procedure, I will be wearing my gloves before handling the catheter. So let me just check. All right. Now, in this situation, I will now be cleaning the genitals of the patient. So I will be preparing my cleaning solution. So I will open the gully pot. It's dry, intact, and in date. Throw this in the clinical waste bin. And then I have here my saline solution and my alcohol swab that I've already checked a while ago. I'll clean it for 30 seconds. And then allow it to dry for 30 seconds. We'll throw this in the clinical waste bin. I'll open the solution. I will throw this in the sharps bin, or as per trust policy. I will pour it in the gully pot using non-touch technique. I will throw this in the sharps bin, or as per trust policy, later. I have here my sterile gauze. This is the gauze I will use to clean the genitals of the patient. So in cleaning the genitals, if the patient is male, or whether it's male or female, you always have to clean in the urethral opening, swabbing away to the catheter. All right. So first, I will get a gauze. I will dip it and then squeeze it, and then I will clean. So granting it's already exposed, I will clean the urethral opening, and then I will swab it away to the catheter. Throw this in the clinical waste bin. Get another one and then dip it, squeeze, and then I will clean the urethral opening, one stroke, and then I will swab it away to the catheter. Throw this in the clinical waste bin, and I will pat dry. Throw this in the clinical waste bin. So Andrew, I've already cleaned your genitals. We're already ready. I've already emptied the bag. So I'm now happy to take out your catheter. Is that all right with you?
Yes.
Okay. So in taking out the catheter, I will be using a 10 ml syringe in order for me to get the water that is introduced into the balloon in order to hinge the catheter in place. Now I will insert it, and then I will take out the 10 ml water from the balloon. I will aspirate it. So assuming that I've already gathered 10 ml of water from the balloon, I will discard this in the sharps bin, or as per trust policy. Just in any case I won't be able to collect 10 ml, I will reintroduce the water to the balloon, and I will stop the removal of catheter, but I will call the urology team to inform them about it so that they can take it out for me. All right? But now, assuming I've gathered the 10 ml, I will now be happy to take out the catheter. All right? Now, in taking out the catheter, again, you might feel urgency, frequency, and discomfort. And you will also, I need for you to inhale and exhale in and out. And in your exhalation, I will be pulling the catheter out. All right? Are you ready?
Yes.
All right. So I will now be pulling out the catheter. All right. There you go. Catheter is out. I will be throwing this in the clinical waste bin. And then, so Andrew, I've already taken out your catheter. This time I will be cleaning your genitals. So assessor, I'd like to assume I've already performed cleaning the genitals of the patient, and now I will recover the patient. I will make sure to discard this in the clinical waste bin and the sharps in the sharps bin, or as per trust policy. I will make sure to clean the tray ready for the next use. So Andrew, I've already taken out your catheter. I'd just like to highly advise you to drink 2 to 2.5 liters of water daily. All right?
Yes, okay. Thanks.
Do you have any questions for me?
Not at the moment.
Is there anything else that I can help you with?
Nothing.
Just in case you think there is any need of assistance, just press the orange button of your call bell. I or my colleague will come to help you. All right?
Okay, thanks.
Now let me just discard my PPE. So I ask my gloves in the clinical waste bin, and then I will just document that I have taken out the catheter. All right. Would you like me to open the curtains?
Yes, please.
All right, let me open the curtains and let me do my final step of hand hygiene. Alright, done.